Hello everybody and welcome to March's edition of the Primary Care Practice Managers event. Just going to share my screen just for a little moment so we can see some faces, because unfortunately I can't see anybody's faces when the screen's up. Thanks so much everybody for joining us. Really appreciate that it's really busy out there, so hopefully the information that we have for you today will be welcomed and will be of interest to you. There will be an opportunity at the end to tell us what it is that you want to hear about to meetings, so please do try and stay on if you can at the end. Hope you've all got a cup of tea and a bite to eat or some sort of drink. I can see Joe smiling. So without further ado, we're going to get on with the agenda. I'm just going to share my screen again. So you know the workforce team, you've met Johnny before, myself, Leslie will be speaking to you. And in the background and a little bit shy is Claire as well, that supports this programme. Speakers today, we're going to have Dawn from HMR Academy talking about the Healthcare Support Worker Foundation programme. Leslie Royal-Pryor, who is our primary and community nurse lead, will then link in with the work that Dawn's doing and kind of tell you about the exciting work that's happening. I'm going to give you an update with Daniel around the workforce bank, and then Jonathan's going to give you an update around the Connect programme. So without further ado, I'm going to stop sharing my slide. I'm going to hand over to Dawn. Thanks, Dawn.
Hi everyone, I'm going to share my slides in a second, as soon as I can bring them up. You may have seen these slides before. They have been updated with new figures on, and it is just to give everybody an idea of what the Healthcare Support Worker programme is that we've been doing. Can everybody see those?
Yes, thanks, Dawn.
Thank you. Okay, so my name's Dawn O'Brien. I think some of you do know me, but I'm the manager of Haywood, Middleton and Rochdale Primary Care Academy. And we have been working with GM to develop the Healthcare Support Worker programme. So the aim of the programme was to support winter and COVID pressures, raise the profile of our healthcare support workers, increase the number of them in primary and social care, look at the nursing career pathway and encourage the career progression into registered nursing and the TNA programme. So who can apply? Anybody can apply. So any new starters in your practice or in care homes and nursing homes, or you can look at developing your current healthcare support workers or phlebotomists. Some managers are developing their reception staff into HCAs and they put them on the course. So the offer, what have we been doing? So it's a 6-month development programme where we cover phlebotomy, basic observations, urine dipstick analysis, a little bit if you're in social care, it's around wound dressing and pressure sores. In general practice, we've been looking at dementia, sepsis, hypertension. We've been covering the care certificate, and we've also been offering functional skills in maths and English for those people who don't have maths and English GCSE and would like to progress further, either onto doing a level 3 or the NA programme or the registered nurse degree apprenticeship. In order to access those, you will need functional skills in maths and English. We have had support of a dedicated supervisor and mentor, and we've been looking to develop people onto the level 3, as I said, the level 3 apprenticeship, the TNA or the registered nurse degree apprenticeship. What does it cost? Magic question. It doesn't cost you anything apart from time, giving your person in your practice time out to come and do the course. So whether they come and do the hands-on phlebotomy course or whether they do the online training that we have or they're doing the care certificate, there is no cost to the practice at all to complete any of the training. So far in primary care, we have had 67 admin and reception staff complete the course, 52 healthcare support workers, 19 phlebotomists, 2 care coordinators and 3 practice managers. From those numbers, we have had 12 have gone on to do the level 3, 24 applied and have gone on to do the September 21 cohort of the NA programme. 12, I actually think those numbers have gone up, are currently undertaking functional skills. We do have some who've applied for their GCSE certificates and are waiting for those, and we will help with costs towards that. So if people can't find their certificates, we will help them to get those. I think they're about £40 to get your GCSE certificates. And we've had 3 go on to do the registered nurse degree apprenticeship. Why are we doing this? Oh, well, what are we doing next? We want to make sure that we have forums available to do further teaching. Leslie is going to speak to you in the second around our next developments and what are we thinking of doing next. We've done Kickstart, and I think we all know Kickstart has not been without its up and downs and has had teething issues, but we do have some Kickstart cohorts who've gone on to do the healthcare support worker have been doing the foundation programme and are going to be offered an apprenticeship at the end of their posting. It's linked in, so everything that they do on the foundation programme is linked into the GM passport for future training and development, and they've all been uploading their information to them so as that we can see what people have been doing. So there is a pathway that we look at. So we've obviously, as I said, you can start off as your admin, reception, your HCA. The foundation course will cover the majority of that. We then got the foundation development, which is coming later. We then go on to do the TNA, or you can do your level 3, which can lead you on to the registered nurse degree apprenticeship. So actually your pathway for starting off as a healthcare support worker is phenomenal. And we do have other free training available. So we've teamed up with local colleges where they're able to offer free level 2 training, and that comes out of the adult education budget. So they're able to go on and do extra topics as you would wish them to do. So there's some around mental health, there's some around diabetes, there is some around nutrition and hydration if you felt that was relevant. But there is also some around customer service and business administration. We've also been delivering the care certificate, and we've worked with Hotwood College to offer the care certificate online. They have a dedicated tutor. They've been offering one-to-one catch-ups and they go through portfolios. They are opening the college, so students are able to go in, which is difficult when you're not in the area. But you are able to go in and the students are able to go in and have teaching time. But we have found that it's worked quite well online, to be honest. There is, as I said, there are some level 3 funded courses. So you've got your level 2s that come out of the adult education budget, and then you've got your level 3s which come out of your apprenticeships. So we can help with advice on apprenticeships, levy transfers, how you can pull that levy down, and of course the funding that comes with supporting apprenticeship in your practice. The Kickstart offer is no longer available. Kickstart, the funder for that has finished now, I'm afraid. That's it from me. Sorry, I was using old slides, but they've just been updated. So that's it, Kerry, from me around the level, the healthcare support worker programme, the foundation that we currently have on offer at the moment.
All right, thanks very much. We will be looking to understand people that would like to refer candidates into Dawn, but I'm just going to hand over to Leslie and I'm going to share some slides.
Thanks, Kerry. Thanks, Dawn. Hi, everybody. I've been introduced. Leslie Royal Pryor, Primary and Community Nurse Lead for Greater Manchester. And thanks, Dawn, for going through that. What a phenomenal programme we've had there for the last, well, over 12 months now, and some fantastic outcomes from healthcare support workers that have joined us on that foundation, and some really, really good feedback on it. So what have we got on offer today? Well, at the last meeting I discussed that we had an idea of running a digital programme. So similar to what Dawn's just discussed with you, the traditional route, this would increase the ability for more people to join the programme. Basically, that was the idea. So it's similar to what Dawn's already discussed, and it includes all the main areas that she's talked about there. It's directly linked to the RCGP competency framework and is again a 6-month programme. So, and it's linked to the GM passport this time. So if you could just change the slide, please, Kerry. So we've worked with leading training providers to produce this accredited and certified training. So part of the programme, as Dawn alluded to previously, this digital one is for the primary prevention of cardiovascular disease. And the course is made up of these 4 modules. So the healthcare support worker will be learning about CVD risk assessment, hypertension, and the management of hypertension in general practice. Next slide, please, Kerry. So this is what the candidates will learn. So they'll have a solid understanding of assessment and management of cardiovascular disease risk factors. They'll understand the importance of accurate clinical history taking and how to carry out that risk assessment. They'll be taught how to analyse data and review in a way such to calculate risk, so CVD risk, and all about NHS health checks and annual hypertension reviews. So this is all certified training from a training provider that we've worked with. Next slide, please, Kerry. So what's different to this from the traditional programme? So it's blended learning. So we have a digital offer that covers the care certificate and the CVD risk assessment over 6 months and 3 months consecutively. We also have the phlebotomy that is face-to-face. So that's a blended part of the learning with the clinical skills training. And we have that competency assessment in practice or through the local nurse training support. So it's standardised quality training at foundation level, and it makes further employment for healthcare support workers across Greater Manchester easier. So practices will know when they get a healthcare support worker that they've actually done a standardised training foundation course. So access to this remains free, so it doesn't cost anything for your staff to access it. It can be done at variable start dates, so there's no actual start date for this. So your healthcare support worker, whatever time they join you or you want them to join the programme, they can access the programme. So that's suitable for any person that comes into your practice at any time over that 6-month period. Additionally, this programme has tailored support and mentorship. So there's supervision of a highly experienced nurse trainer who will be accessible and supportive to both the trainee, the practice, and throughout the trainee's learning and development. This means that if required, your trainee healthcare support worker can be supported both on or off site to reach the foundation level standard. Currently, we're planning to pilot this in Stockport and Sulfur over the next 3 months. And through this period, we'll have some intensive evaluation and hopefully have this programme then ready to be available across Greater Manchester by early June. My colleagues from Salford and Stockport are on the call as well. So I don't know, Maria, if you want to say something.
Hi, yes, I'm Moira Gunsarkin from Sulfur. So we will be supporting the course as it develops, and we have an experienced nurse ready to go into practices to support the healthcare support worker. These are practice nurses, so they know all about QOF standards, they know what a HCA should be doing to get those points ticked, as well as maintaining the RGCP standards competency framework, so that we'll be working really closely alongside. So we're ready to roll for anybody in Salford, and I think Maria's the same in Stockport.
Oh, done it now. Sorry, I was struggling. I couldn't get myself off mute. I'm pressing and pressing. No, absolutely. So we'll be getting some information out to everybody across Stockport and trying to get a few in so we can do a really good pilot and then get it across GM.
Fantastic. Thanks very much for that. So we've got some questions for you really, and Claire's going to put a poll on the screen. So if you'd be kind enough really to kind of give us an indication and your response. So are you thinking of employing or upskilling a member of the staff within your team? And would to be a healthcare support worker? You can give us a little indication, that'd be great. So there's 11 of you at least that are interested in this. If you're within Stockport or within Salford, then please link in with Moira and Maria in order to participate in the pilot of the digital programme. Otherwise, Dawn's programme continues to run, so please contact Dawn. We will put some contact details in the chat as well, so you can do an expression of interest. And I suppose the question to you is, we know that we've had over 100 individuals that have gone through the programme, the historic programme that Dawn's team manage. And we'd be really interested to hear, have you accessed that programme at all? So we've got one person that has accessed that two, and it's growing. Well, hopefully there's 20 of you out there that now know about this opportunity and will be able to refer individuals in. So that's a positive. And really, of those people who have already accessed the programme, would you recommend it? Would you recommend it to one of your peers? And it's just another question coming up. Nice big yes. Fantastic. Okay, that's great. And obviously, kind of just thinking about what Leslie was talking about around the digital offer, the blended offer, it's a hop on, hop off. It can start anytime. Is the digital offer attractive to you? Is it something that you'd be, keen to put your member of team onto? Okay. Okay, that's great. Okay, fantastic. Thank you. Leslie, I don't know if you had any, just in response to those polls, whether you wanted to add anything.
No, that's excellent. Yeah, so that's really encouraging. I think we all know that times of the essence when we've got a new starter, and if there is a variable time that you can start or finish, and get onto that course, it's much better. And also it means that you can start the course at whichever point you want. So if you want your new starter to be a phlebotomist first and foremost, they can do that part of the course first. Or if you want them to do the hypertension or the cardiovascular disease risk assessment part, then they can do that bit first. So it's entirely up to yourselves. There is some links to like we said, the care certificate online as well. So everybody will be completing that if they haven't already done it. And also there are some modules with e-learning for health that are sort of mandatory and statutory modules that we would look to people doing as well. So it's all linked in quite digitally there for them to do. And obviously we know how long it should take. We know that it's a 6-month course. However, that's obviously individual to each learner of the time they take to complete it. Now that could mean that could be an hour per week that you see your new person undertaking that course. So that's entirely up to you how you set that out. So thank you for that. Thanks.
All right, fantastic, thank you. So that's the healthcare support worker, both the existing and the, sorry, there's just some distraction in the chat. Is it only open to the workforce in Salford and Stockport? It's being piloted with Salford and Stockport at the moment. So we do hope that by the time we get to midpoint, so around about May time, we'll have a really good evaluation in order to indicate whether it's going to be valuable to expand into right across Greater Manchester. So we will keep it on the agenda and we will come back to you and kind of give you the feedback that we've had, and obviously try to ascertain your feedback as well in terms of how you found the programme.